Jeff.
Hi.
I'm Kris. I'm your nurse practitioner today.
Okay.
How are you?
Good.
Good. I see my nurse offered you a gown.
Yes.
Are you comfortable?
Yes.
Did you empty your bladder prior to getting dressed?
Yes.
Great. Let's go ahead and start this physical exam. We're going to go ahead and start with the height and the weight. If you come out here with me and step on the scale, that would be wonderful. All right, go ahead and stand over here. 193.2 is his weight. And he is 71 and a half. Go ahead and go back in and we'll get a set of vitals from you. Start with your temperature. Oops, 124/78. Temperature is 98. Heart rate 60, respiratory rate 16. Right, so we'll start this exam. We'll go from head to toe. So we're just going to start by looking at your head, and then we'll go to your face, your eyes, your ears, and so forth. Okay, sir? His scalp is normal cephalic. It looks atraumatic. He does have some freckle-like lesions that are flat, macular, non-raised, just slightly darker than skin coloring. He has three, looks like some red papular lesions. That is consistent with heat. His hair is fine. Male pattern baldness by temporal, parietal, as well as over the crown. He's got no scaling, no nits, no lesions behind his ears bilaterally or at the base of the skull. When I palpate, everything feels symmetrical and even. Any pain?
No.
All right. And back behind at the base, he does not have any occipital lesions. When you look at his face is symmetrical. His eyebrows are symmetrical. Nose, mouth. His ears are in good alignment bilaterally. His eyebrows, his facial bones. Any pain over in any of your bones?
No.
All right. His sinuses are non-edematous or swollen. Are they tender?
No.
When I palpate them?
No.
No? Okay. Equal distribution of the hair in his eyebrows as well as his eyelids. Any pain over your lacrimal ducts?
No.
All right. He does have some sebaceous-like lesions on the tops of his eyes, but nothing else that I see. He's got a couple skin tags. Below this, go ahead and open your eyes. He's got nice distribution of his eyelashes bilaterally. There's no crusting, no styes, no nodules. Any tenderness when I palpate over your eyes?
No.
Okay. Open them up and look above. His conjunctivas are pink, no cobblestoning, no drainage. His scleras are white. Go ahead and start with your eyes. We're going to test cranial nerves number 2, 3, or number 3, 4, and 6, which is oculomotor, trochlear, and abducens. And we're looking at they're symmetrical. There's no ptosis. We're going to follow my finger, doing extraocular movements. So just follow my finger with your eyes. I see no facial tics, tremors, no abnormal positioning of the head. Extraocular movements are intact. It's got nice convergence. We're going to look at pupillary response, direct and consensual, nice and brisk, nice and brisk, consensual, intact, consensual. Oh, before we do anything else, I'll go ahead and do the red light reflex, which is part of the fundoscopic exam, but we're going to limit our exam today to the red light reflex, and that is cranial nerve number 2, optic. If you look at a point beyond my shoulder distance, I'm going to look in, okay? You got a nice red light reflex there. And you got one right there, very nice. And the last thing we're going to do with regards to your eyes, we're going to do a cover and uncover test. I'm looking for strabismus and nystagmus. If you focus on my nose, which is an object that's close by, I'm going to pull it away, and there's no strabismus or nystagmus. Eyes are midline and good. Now I'm going to look at your ears. Look behind. Any pain in your mastoid area?
No.
Preauricular area? There's no tags, lesions, skin nodules. Any pain when I pull on your outer ear?
No.
The auricle is smooth, non-edematous, non-red. There's no drainage. It looks appropriate in configuration when compared to the other side. And again, the alignment is good. There's no lesions over here. Any pain with palpation?
No.
Any pain over here? And no tags in the preauricular area whatsoever. We're going to look at the tympanic membrane. There's no drainage. And again, the configuration of the auricle is nice. There's no swelling. The tympanic membrane is clear, translucent, pearly gray, no effusions. No fluid. Umbo is present. Malleus is present. The ear canal is without erythema, edema, drainage, foreign body, or excessive wax. There's a small amount that is circumferential. The same over here. The findings that I found are consistent with the opposing ear. We're going to test the hearing. So I'm going to test a cranial nerve number 8, which is acoustic. We're looking for equal distribution of sound in both of your ears. Let me know if one side is louder than the other.
Equal.
Equal. Great. Okay. Now we're going to check ear and bone conduction. That was the Weber test. Now we're going to do the Rhine test. If you can tell me when the sound goes away, that would be fabulous. Okay, ready? Okay, that was 20.
Okay.
59 seconds, so that's normal findings. So So we'll do it again over here.
Okay.
32.
Okay.
63. Again, very normal findings. So now if you would include your opposite ear, I'm going to whisper in your ear and have you repeat back what I said.
JKDC67.
Okay.
Seven, 4, 3 ABF.
Very good. So now we're going to look at your nose. And your nose is firm, a little bit more prominent on the right side than the left. Have you ever broken your nose?
No.
There doesn't feel to be any saddle deformities whatsoever, and it's stable. No skin lesions on the outside. Septum looks midline, both internally and externally. We're going to look in your nose. You have +3, +1 turbinate. I can see back to the soft palate. Can you swallow? And I can see movement. It's pink. There's no lesions or erythema. Septum's midline. +1 turbinate on this side as well. No crusting. No bleeding. Mucus is pink. So septum midline, no septal defects, no lesions, no perforations. Turbinates +1 bilaterally, there's no drainage. Both are widely patent. Go ahead and deep breath in and blow out. Deep breath in and blow out. All right. Go ahead and open your mouth and close it. Again. No crepitus. Any pain with opening?
No.
No crackling or popping sensations that you can feel or hear?
No.
Okay. So that's your TMJ. So go ahead and open your mouth. All right. Which you have nice ability to open your mouth very wide, which you're talking about 6 centimeters. Go ahead and can you jut your chin out? Tuck it back in. And then side to side. Okay. Which is about 3 centimeters. Other side, which again is about 3 centimeters. Can you stick your tongue out? Because we're going to look at your cranial nerves now as well. That's your cranial nerve number 12, your hypoglossal. And stick your tongue out, up and down, side to side. Awesome. Put it in your mouth and push against my hand. This is cranial nerve number 5, your facial or trigeminal nerve, sorry. Go ahead and clench your teeth and then open your jaw against my hands. Okay, clench your teeth again. And again, we're doing the same nerve assessment for trigeminal. Now for facial nerve number 7, go ahead and smile, clench, close your eyes tight, wrinkle your forehead, and don't let me push it up, and puff out your cheeks. All right, that's perfect. Go ahead and push against my, yep, and again with my other hand, turn your chin to your shoulder against my hand. Turn your chin to your shoulder the other way, okay, and then this way. And go ahead and look up, down, okay, side to side, and then ear to shoulder. Very nice. So we're looking at shoulder shrug up and down, shoulder shrug up and down, push against my hands. That's nice. So we just did spinal accessory, which is cranial nerve number 11, and we're looking at trapezius muscle strength as well as sternal cleidomastoid muscle strength. Your neck is symmetrical. I see no protrusions or abnormalities. The skin looks healthy without any lesions or visible nodules. And again, we looked at your lymph nodes, pre-auricular, post-auricular, occipital. We're looking at superior, or your cervical, your deep cervical, and your posterior cervical chain, your tonsillar, submandibular, and submental. All are absent. And I'm going to palpate over your parotid glands, your submental glands, and your sublingual glands. Any pain with palpation? No swelling, edema, or warmth. I'm going to deep palpate in your neck, and I feel no masses. Okay. And I'm going to palpate your trachea, which is midline. I'm also going to have you tilt your head back just a little bit. I'm looking for your thyroid. And go ahead and swallow. Very good. It's small, soft, symmetrical, and non-tender. Jeff?
No.
Okay, good. And I feel no nodules. Go ahead and turn your head. I'm just going to palpate your carotid. I see no evidence of JVD on either side, so jugular vein distension. Turn. I'm going to palpate the carotid, which is very palpable. Take a deep breath and hold it in. No bruit, let it out. We'll repeat the same on this side. I'm going to palpate the carotid. And no bruit, let it out. And I am going to auscultate for a bruit over your thyroid as well. And I don't hear anything at all. All right. And then your last nodes would be your supraclavicular, which you do have a scar over your supraclavicular area over here, but I feel nothing. What, did you have surgery here?
Yeah, I had a mass in there.
And what was it from?
Cat scratch.
Okay. And I feel no nodes in your chest. And then I'll get your axillary nodes when you lay down, okay, as well. So we're done with, oh, I gotta look in your mouth. So let's go ahead and look in your mouth. Say Palate is normal. Skin's pink, healthy, no lesions. Go ahead and lift up your tongue. Nothing under your tongue. I see no leukoplakia whatsoever, no ulcerations. He does have 2 cavities that look like they've been filled. On the top, it's the second molar on the upper left, and it's the first molar on the lower left. No other caries. No other lesions that I can see. I'm going to say Symmetrical soft palate. Uvula's midline. Tonsils are +1. No lesions on the palate or the retropharyngeal or the oropharyngeal area. There's no evidence of cobblestoning as well. Everything's nice and pink and healthy without drainage. And then I'm just going to palpate in here. Okay, and you feel nothing. Stick your tongue out. And your tongue feels nice and soft, no nodules. Any pain when I palpate? All right, and I did test your carotids.
Mm-hmm.
Okay. Now we're going to go on to your lung exam. And I'm going to start and just have you breathe normal. Take a deep breath in and deep breath out. I see no nasal flaring, no evidence of respiratory distress. Everything seems to be equal. bilaterally. We're going to come around to the back, Kobe, and we are going to percuss. Which is symmetrical. And I'm going to test for tactile fremitus. Fremitus. Can you say 99?
99.
99.
99. 99.
It's very equal and symmetrical. The skin looks good. There's no abnormal lesions on the back that are concerning. He does have some freckling, but nothing that is raised or asymmetrical. Take some deep breaths. Go ahead and lift up your arms. Lungs are clear to auscultate in the posterior fields. Going to look at lung excursion, which I previously had marked. Sorry, he wasn't my husband. So go ahead and take a deep breath in and hold it. Okay, which is marked right there. Exhale. Do it again. Okay, exhale. And then we're going to go ahead and have you take a deep breath in and exhale completely and hold it. Right here. A little higher this time. And then do it again. Right here. Okay. Nose measure. 6.5. 6.5. Very nice. Okay. And then we'll go to the front. And on your front, we have symmetrical hair distribution, symmetrical breasts, belly. Breastbur's easy and non-labored. He's got a little scab lesion here. Looks like from
Hair follicle.
Infected hair follicle, or a hair follicle, which is non-infected, non-tender, non-erythematous, non-fluctuant. Deep breath. Lungs are clear in the posterior or in the anterior fields. Say 99.
99. 99. 99.
And it's symmetrical palpation. Okay. We'll go ahead real quick. And listen to your heart tones. Aortic. Aortic, pulmonic, herbs, tricuspid, mitral, and then we'll listen again. Now check your axillary nodes when I lay you down. Okay, go ahead and lay down. I'm ready to proceed. There you go, make yourself comfortable. And go ahead and put this arm up over your head. And again, I'll feel again in your chest for lymph nodes, your infrasternal nodes, and your axillary nodes. Okay, go ahead up here. You ticklish?
A little bit.
Sorry. And there's no nodes palpated at all. Sorry. All right, we'll go ahead and listen one more time when you're laying down for murmurs. And I hear regular rate and rhythm, S1, S2, no clicks, no murmurs, no splits. I see no heaves. I feel no thrills or feel no heaves. I'm going to palpate near point and maximal endpoint, 5 minutes. Okay, good. Belly's nice and soft, non-distended, no abnormalities. I'm going to palpate the liver. I'm going to palpate the spleen. I should have auscultated first. Active vowel sounds. Now auscultate the aorta, the right renal, the left renal, the iliacs, and the femorals. And I see here no burleys. Okay. And I have a previous mark from where the liver starts. That stops. And we said that was 6 centimeters. And I cannot hear a spleen over here. Okay, go ahead and set on up. Alright, we're going to do, how long do we have left, Cubs? 4 minutes? Okay. We're going to look at your hair distribution. It's equal, non-tender, tender calves. Okay. Plus 2. Marcellus penis, posterior tib, popliteal. Go ahead and do reflexes. Okay, relax. There we go, nice. Plus 2 reflexes. Skin distribution on your arms, nice. You got your brachial, radial, plus 2. Plus 2, plus 2. Go ahead and relax your arm. There you go. Very nice. Okay. And then we'll go ahead and do this. This is fine motor. Awesome. Go ahead and push, pull. Go ahead and stand up. Put your arms out to your side. Don't let me push down. Push me away. Awesome. Put your hands at your side. Close your eyes. Okay. Good. Okay. Heel to toe. Walk. Okay. Turn around. Come back. Okay. Perfect. Can you rub your shin against your heel against your shin? Perfect. All right. And then just tell me if you can touch. If the sensation is equal bilaterally.
Yes.
Yeah.
Yes. Yes.
Yes.
Yes.
All right, sir. I do believe we just have one last thing. Can you lean forward? Touch your toes. Good. Your spine is nice and straight. Go ahead and lean back. All right. Go ahead and take your knee out behind you. Awesome. Forward. All right. Do the other one. Forward. And then if you just go from side to side. Okay. Perfect. This concludes your exam. Thank you very much, sir. You're a very healthy, normal 40-some-year-old man.